Welcome, and thank you for joining the Epidemiologic Modeling for Foot and Mouth Disease Emergency Preparedness Call. Before we begin, please ensure you've opened the WebEx participant and chat panels by using the associated icons located at the bottom of your screen. Note that all audio connections are muted at this time, but you may send your questions to all panelists in the chat box, and they will be addressed at the end of the conference. If you require technical assistance, please send a chat to the event producer. With that, I'll turn the conference over to Liz Fernandez.
Hi, good afternoon, everyone. I'm Liz Fernandez with the Professional Development Services Branch, and I'd also like to welcome you to today's National Training and Exercise Program webinar on modeling for FMD emergency preparedness. The Training and Exercise Program would also like you to be aware that our FMD vaccine workshop is ready for use, and an FMD vaccine tabletop exercise is under construction. Enjoy today's webinar brought to you by the Vet Services National Training and Exercise Program. Our speaker today is Dr. Lindsey Holmstrom. Dr. Holmstrom is a veterinary epidemiologist at the USDA APHIS Veterinary Services Strategy and Policy Center for Epidemiologic and Animal Health. As part of SIA, she helps advance and apply epidemiologic models and data analyses to evaluate disease spread, alternative control strategies, and associated impacts of transboundary animal diseases. Lindsey also serves as an epidemiologist on the Veterinary Services RED Incident Management Team. And with that, I will pass the webinar over to Dr. Holmstrom.
Thank you, and thank you for this opportunity to share with everyone an overview of the foot and mouth disease epidemiologic modeling that is performed within USDA for emergency preparedness and response. I guess I'd first like to say that, these are very unprecedented times right now with the current COVID-19 pandemic, and I hope everyone is safe. And let me take this opportunity to express my gratitude, as I know a lot of our agricultural family are out in the field or in facilities to ensure a safe and available food supply to the U.S. during this time. The presentation today, given within the current setting of a pandemic, I think further emphasizes the value of emergency preparedness and the activities currently ongoing within agriculture, such as through research, the National Training Exercise Program exercises that Liz just mentioned that are ongoing, everything from technology development to deployment, the secure food supply plans, and investments in resources such as foot and mouth disease vaccine. And so modeling is one tool that can be used to also support emergency preparedness as well as during an outbreak response. And so I'm sure many of you have also heard or seen some of the modeling that's being used currently to inform decision support and distribution of resources for COVID-19. So first, to start and give an overview of the modeling team and who we are at the Center for Epidemiology and Animal Health. So USDA leadership has seen the value in modeling, and in 2013 created a modeling team within SIA. We're composed of agricultural economists, biological scientists, and veterinary epidemiologists, and we can collaborate and configure and apply animal disease spread and economic models. We initially had started with regional models for foot and mouth disease and African swine fever, and then as we went through those models and worked more with industry and with the states, the need of really applying these models at the national level were very much evident, especially given the economic consequences of these diseases on our industries, including in areas not necessarily impacted or infected, but a disease in one area can have national level consequences throughout the industry. So with that, we have developed national foot and mouth disease models, HPAI models. We've also have continued to increase and develop our economic models. Most recently has included development of vector-borne disease modeling, national models for classical swine fever and African swine fever throughout the years, and then every year really we're always evaluating our models and updating our parameters and gathering data to hopefully make these models most useful as possible. The plans for currently and going into the future include looking at within the feedlot, so looking at feedlot modeling within large feedlots, so looking at disease spread, so looking at foot and mouth disease spread within a feedlot and what different options we might have for control when we're or in addition to or besides mass depopulation within a feedlot, and that's linked to most heavily an economic component. So that's a collaboration with a state university, and we look forward to being able to present some of those findings in the future. We're also involved in looking at the future of these modeling tools and make sure that they can continue to address and answer questions of our leadership. And so we're involved in looking at what we're calling next generation modeling. So that's looking at new tools. What does it look like 10 years from now that we need these models to be able to do? How can we take advantage of a lot of the support infrastructure and investment that USDA is making into information technology and data science. So that's an ongoing project we have with Texas A&M and their computer engineers and computer scientists at the Texas Center for Applied Technology. And then we're also looking into ways that our modeling can support decision support, especially when you have multiple states or multiple decision makers requesting the same limited resource. So that's obviously very relevant right now with what we're seeing with the COVID-19 pandemic. But basically we're looking at using game theory as a way to look at when you have multiple players asking for the same resource and how modeling can help, kind of explore that area. And that's a collaboration with USDA's Agricultural Research Service as well as Kansas State University. So the outcomes generated by these models, they inform emergency preparedness and planning. They support business continuity. They can help forecast market and trade impacts of disease outbreaks and then estimate potential indemnity costs related to outbreak control efforts. So we use these very much as emergency preparedness tools. We have had to use them for outbreak response, such as an HPI outbreak, as well as currently with the virulent Newcastle disease outbreak in California. So I'm going to focus on the FMD modeling, and the presentation today will bring together some of the key points on the use of vaccine during an outbreak and hopefully help inform states and tribes as they develop their vaccination plans. So as Liz mentioned, there's plans for exercises looking at the use of vaccine that are planned for this year. I won't be presenting any outcomes for different states, but more trends and key points that we have seen from the modeling work that we've done previously. I believe the plan is for us to continue to do these type of modeling webinars and update these models and hopefully do that with input from the states and tribes as far as the types of vaccine plans that they're planning to implement in their states. So first, I'll provide an overview of the model. So the map you're seeing here, it's called a hex map, but basically it's a county level visualization of animal and farm densities and production types. So it's very similar to, and part of the data are actually from USDA's National Agricultural Statistics Service. So some of the maps, those density maps you've seen from NASS, this is very much similar, but here we're showing, two different things. So it's showing the density of farms, or the number of farms per county displayed, which is displayed by the size of the diamond polygon that you're seeing. So you can see, for instance, in California and along the Pacific coast, as well as in central and east U.S., have a higher number of farms, so they have larger polygons, to the point that it makes it actually hard to see the borders of each polygon. And then the color is showing the mix of production types. So, we have a lot of different production types that are within the U.S., and this kind of highlights where those mixes occur, and I'll speak just a minute on the importance of that. So this is our national population file. We do simulate farm location distributions that are based on empirical county level USDA NASS census data, as well as GIPSA data and then data that we gain through partnerships with industry, states, and universities on gaining access to and providing that data to us. We do take county data of number of animals and farms and use the farm location and animal population simulator developed at Colorado State University to smartly place farms and animals on those farms within the county. So our population file, each farm does have a latitude and longitude, and they're smartly placed, meaning it's a bunch of different GIS layers and algorithms that look at where most likely in a county is a farm to be located. So not in the middle of a big city and not on top of a tall mountains, for instance. Our farm file has 26 production types. So it includes commercial bison, beef and dairy cattle, to include dairy calf heifer ranches. That's something that was fairly new that we added to our population model last year. We have goats, sheep, and swine, and then we have dealers, processors, and slaughter plants, and then livestock markets for all of those species. And so our production types are further broken down by size due to differences in management practices and movements that can affect disease spread. So in total, we have over 1.2 million farm units within our national foot and mouth disease model. So the mix of density and color, going back to the map that you see there, represents the mix of farm types, and it's what can make an outbreak response complex, especially given FMD is one of the most infectious diseases of animals. And so if you've listened to the previous webinar regarding foot and mouth disease vaccine that Dr. Daryl Stiles presented, he talked a lot about the mixing of farms where you have cattle near swine, or you have dairy and beef that are closely intertwined, or just have large farm densities of animals, such as what you see in Florida. But even in areas with lower density, we also know that we have and short distance movements of animals. So we have, movements of across states or across many states. So all those things can make a response and decision-making complex. And so modeling is one tool that can allow us to look into those complexities and hopefully provide input as decisions are being planned for what an FMD outbreak response would be. So speaking of animal movements, movements of animals within our model are based on the U.S. livestock industry movement patterns. So we represent both short and long distance movements. They're based on known characteristics and patterns within the different livestock industries. And then these movements also include movements within swine companies and their network type movements to account for U.S. company ownership and structure of those companies with directional movements within a system, but we still can have indirect contacts between systems or between companies. We can also represent regional differences in movements within the model. So we can say that, movement or even management practices of dairy, for instance, in California are very different than those in other states or those in other regions of the U.S. And so the colors on the maps that you're seeing there is one grouping of states into regions that we can do, and we can do this many ways, but it's a capability of our model that we're able to do that. We also account for indirect spread from movement, which includes people and vehicles that could potentially spread disease, as well as local spread or disease spread that is associated with distance between infected and susceptible via mechanisms that are difficult to trace, such as wildlife. And again, the data from these comes from academia, from the NOM studies. Those national studies that occur every year are really important for us to get these types of trends in our region, and to be able to know what happens in the different livestock industries, as well as collaborations we have with cooperators and other partners throughout the agriculture enterprise. And so another part of our model is the control strategies. And so within our model, we have the ability to model different types of control strategies in an integrated fashion. So by doing that, we're able to represent strategies that might be implemented by states or tribes, as well as what's in USDA's FAD prep guidelines. So this is one of the key strengths of the model that allows us to compare, the current state of control programs that would be implemented in the U.S., as well as for us to compare, different adaptations or different strategies that might be used by states or tribes during an outbreak. So kind of looking through these individually, so for movement restrictions, we're able to model both state or nationwide level movement standstills after foot and mouth disease is detected. We can also model movement restrictions within control zones, both for animal and indirect movement, such as milk trucks. And so we can vary those, and doing so allows us to also use the model based on what the secure food supply plans have in place, such as allowing the movement of secure milk in some instances. For the current modeling examples I will show, right now we've been modeling the 72-hour movement standstill after detection. Another thing we can do is we can alter the probability that producers or farms will actually abide by those movement standstills and movement restrictions, so we can look at different effects of, for instance, biosecurity even within our zone. We can also model active surveillance of how it would be applied in the U.S. So we can implement different types of surveillance strategies. So for active surveillance, we can represent surveillance activities within zones, such as the ability to detect disease based on characteristics of the test used, when surveillance would start, how big a zone, what the frequency is, et cetera. We can also implement surveillance based on trace forward and trace back, and show the value of having a national traceability system. Tracing can be a very resource-intense activity, so the benefits of having a national system and the ability to trace as quickly and as easy as possible is so critical in a disease like foot and mouth disease. But we can also show the tracing of indirect contacts and what that might look like. And so for foot and mouth disease, the surveillance could be very intense. So, within control areas, our surveillance plans call for doing testing a premises twice within the first 14 days of that control area being stood up, and then every 10 days after that for 56 days after the last detection in that area. And then within surveillance zones that would be formed outside of the control area, they call for testing within the first 72 hours of detection and then testing every 10 days after that. So there's going to be a lot of repeat sampling of farms within an area that can really, affect the resources available for you to be able to apply to other things such as vaccination or depopulation. We can also monitor or model passive surveillance during the silent period. So this represents, the reporting that would occur before FMD is detected. So it's the passive reporting by producers or veterinarians to state animal health officials that can vary to, due to many things, such as the ability to recognize clinical signs suggestive of FMD and how that varies based on the different production types. And then we can also monitor passive surveillance during the control phase, meaning once it's known that we have FMD in the country. So once it's officially announced as being detected, what's the increase in likelihood that a producer is now more aware that there's disease in the U.S. and hopefully more likely to both look for signs of disease on their farms as well as report that to the appropriate authorities. For depopulation, we can model the depopulation that can vary with the time and resources it takes to accomplish this task by different production types. So, for instance, if you were to depop a large feedlot, that could take upwards of 80 days to complete. So we can model, the differences in that between the different production types we have. We can also model which production types are depopulated. We can model the time it takes between depop and disposal and disinfection, so you still can have a risk of disease spread indirectly off the farm that has been depopulated, but the disposal and disinfection have not been complete. That's happened in other outbreaks, such as South Korea, that being a risk of potential disease spread. So that's something that we can account for in the model, is having, that virus in the environment and what's the risk of it spreading. And then finally, for vaccination. So I'll discuss in more detail some of the different strategies we previously looked at to consider for vaccination, but our model allows us to implement various vaccination strategies, such as by species, production type, age class, the different zones or how it would be applied, so circular or ring zones around detected farms, for instance, for containment type strategies. We can look at protective zones, so do those, kind of donuts around a control area, for instance, or we can, do more explicit zones, so a full geographic area, so, vaccinating within a county that's affected or vaccinating surrounding counties, or doing a large region, such as an entire state or multiple states. We can also model and change the priorities, so we can say, which age class or which species or which production type is going to get vaccine. We can, vary how that vaccine is applied, such as, do you start close to where there's a detected farm and then work your way out, or do you start on the outer edges of your zone and work the way in, or is it random, or is it by, the size of a production type, et cetera. And then we can also model the coverage that's needed. So, is it a blanket vaccination strategy that works best, and that's, vaccinating every production type or every species that's in a zone, or do you target it more and do, for instance, 85% coverage? So what we'll show is going to heavily focus on the first 14 weeks of an outbreak. And the reason for that is that's when, those first 14 weeks essentially tied to the vaccine supply that we have in our national vaccine bank. And so that's what we're going to rely on until we can get continuous production of vaccine, which is estimated to take about 14 weeks for that to occur. And so with vaccination, a key point, and I think one of the main points I want to make today is knowing what the vaccination capacity is. This is one of the biggest things that we see can really affect the success of the vaccination strategy and being able to control an outbreak. And so we can model different capacities for distributing vaccine and doses that are available within the 14 weeks. And so this is showing, what I'm going to call like a moderate vaccination capacity. So after first detection on day one that you're seeing there, we'd have to make sure that we can match the strain to what we have into the bank. And so there's a little bit of delay or potentially a little bit of delay in getting that vaccine available. And so looking in this case, that we can have vaccine arrive by day 7 to 14 after detection. We can then look at, okay, well, we have a certain amount of doses, and these doses can vary, throughout the first 14 weeks as far as kind of that batch production that companies are able to produce. And so looking at this case, for instance, if we start initially with 100,000 doses of vaccine for the first week, that's about being able to vaccinate about 25,000 animals a day for the first week, and then ramping on up to about 210,000 animals, at maximum capacity of being able to vaccinate that many of approximately 30,000 animals a day. And so these capacities that we looked at include both getting needle into animal, as well as any tagging of animals that are required for identification, or the process of the requirements to record, on the premises, what animals are being vaccinated. So this is, your rate limiting step. And again, the most important for being able to have successful vaccination strategies. I'll note that, for vaccinating swine, to get them at the same level of immunity as cattle does require a booster at 2 weeks. Anyway, so at this capacity that you see here with the moderate vaccination capacity, you have enough vaccine available compared to what's currently in the vaccine bank. So if we look at approximately 2.5 million doses, that could last you 78 days or 11 weeks until you get to that point of continuous production. Again, that's assuming that you're using all your doses that you have available for that day and getting those doses into animals. I'll also note, too, that this 14-week is really important, where we focus a lot of our time from a modeling standpoint, too, is because in most of the outbreaks that we run and evaluate, most of your infected premises that get detected occur within those first 14 weeks. This is why the FMD Vaccine Bank is so critical. I think why investments are being made to increase our capacities for that vaccine bank, but this is also why, we're putting a lot of focus on strategies and working with states on vaccine plans to be able to look at, how best to apply a vaccination strategy within those first 14 weeks. And then this is just showing, the high vaccination capacity type of scenario where you have more doses available during that same time period. And again, one of the issues is, how soon do you run out of doses based on, how you apply that vaccine and what's available within our vaccine bank. So this is where modeling can be really helpful, so we can evaluate those what-if scenarios and help identify optimal control strategies that are scientifically evaluated before an outbreak. And that's also why having a vaccination plan and testing those plans before an outbreak is so critically important. So considerations for vaccination plans. So I'll present some of our findings today for FMD vaccination in the context of helping states and tribes with their vaccination plans. As I mentioned, I'm going to just, for this first webinar anyways, just distill it down to the key points for plans with focus on use of vaccine after detection. So not saying, what you should do or what's most appropriate for each state. Again, we didn't model, or I'm not presenting, each state and kind of evaluation of each state, but more just overall some of the trends that we see and some key points most critical so that your vaccination strategy is most successful at decreasing an outbreak size or protecting an industry that could be ruined due to losses from production or depopulation. And so before I kind of go into some of these key points, just to kind of get you to see what we're about to present here, we run multiple iterations of a scenario to get a range of outcomes. You can think of one iteration being one outbreak possibility. And so to compare scenarios across all those iterations, we're going to do that for this presentation by comparing the mean, which is the diamond that you're seeing. I don't know if my cursor shows up, but the diamond that you're going to see on the slides represents the mean. And then the range of all the different outbreak possibilities that we see is going to be represented by these gray bars. So it's representing the lower 10th percentile and the upper 90th percentile ranges for the outbreaks that we see. And so where you see the diamond in the middle of the bar, that kind of lets you know that you kind of have, within that scenario, you kind of have an even between large and smaller outbreaks occurring, versus if this diamond, kind of goes more to the right, you kind of have more larger outbreaks, so it's more likely to have larger outbreaks, versus if it goes to the left, and that's when you have smaller outbreaks. So, you hear a lot in the news right now about flattening the curve for COVID-19, and here we're trying to essentially shift the curve to the left, meaning you have a shorter duration or a smaller number of infected premises during an outbreak. So we're wanting smaller outbreaks, so we're trying to shift the curve to the left. And so what we'll be doing is showing multiple scenarios for different start locations. So we're picking start locations that are in, if you think back to that map, in different areas where you have that mixing of either high density of dairy or high density of swine or high density of beef cattle will be presented to kind of get across some of the key points we'll make. So you're seeing here on the right that we'll have each scenario is a row. And so we'll stack different rows on top of each other to look at different or compare multiple scenarios within a region. And then the blue diamond is always going to be comparisons to a non-vaccination scenario. And then this orange diamond is vaccination scenarios, or scenarios being compared where vaccination was applied. And then the numbers on the top and the bottom are the same, but essentially that's the number of infected premises that we'll evaluate. So key point number one, so we'll jump into some of the key findings that we've made over the years with foot and mouth disease modeling. So use of vaccine in the containment zone will reduce the outbreak in terms of a number of infected premises as well as in the duration. So these are comparing scenarios where we're looking again at 85% coverage within containment vaccination zone, meaning zones that are occurring around the detected premises. So after you have a detected prem, you're throwing a zone around that, a vaccination zone, and then you're trying to get vaccine in the animal as quick as possible. So you're seeing here the comparison of scenarios for the 3 different start locations, so beef, dairy, and swine, and within them comparing 4 different scenarios of not using vaccination at all versus applying vaccine in 3 different size zones. And so you can see, first off that in all cases that we can shift the curve to the left or have smaller outbreaks and smaller durations if we apply vaccine within containment zones. And so in beef and dairy, we see the most impact of that when it's at within the zone at the 10-kilometer size compared to a 5 or 3. And then in swine, interesting, the most effects we see is when it's applied within a 5-kilometer zone around the detected premises. And then again, this starts with the infected swine company or commercial swine premises being infected for those scenarios. So some of that difference with swine is, I think, more so due to, if you decide to do the booster vaccine or not for swine, or even if you decide to vaccine swine at all, you can still have risk in those areas, especially where you have cattle being close or within an area to swine. But a lot of your spread, too, occurs within a swine company and potentially indirect between multiple swine companies. So some of the spatial spread that we see is a little bit less around swine compared to beef and dairy, but we still have a lot of potential disease spread within a swine company. But mainly big picture here is, and the key point is that containment vaccination in close proximity can reduce the outbreak size. So I think, when in doubt, or if you have limited vaccine or, limited doses available, a key point is that there's benefit of starting close to a detected farm and then moving outward for that. So we see with even a small zone size of that 3 kilometers can still have a benefit of helping reduce the size of an outbreak. However, for this to work, getting vaccine into animal as quickly as possible is what's most important. So that brings me to key point number 2, and this is the one I'll kind of touch on a little bit more heavily, because this is really what's going to influence and most important for a vaccine strategy. So whether it's a containment strategy or a protective strategy, the rate of vaccine application, both in terms of how quickly you can finish control areas, as well as how many zones how quickly you can finish a vaccine zone, as well as how many vaccination zones you can operate in at one time, is going to determine how successful a vaccination campaign will be. And the importance of that is because we have to build up that herd immunity. So as quickly as we can get vaccine in the animal, the better these strategies are likely to actually help you to, again, shift that curve to the left. So this is showing, just kind of looking at beef and dairy, comparing a high-capacity vaccination strategy. So again, you're vaccinating upwards from 50,000 plus animals, or getting 50,000 plus doses out to areas within a day. So at high capacity, you can have smaller outbreaks, but you can also have, smaller outbreaks too at that moderate capacity. So being able to sustain about 20,000 doses per day. And really what that breaks down to, or what that means is knowing how many animals might be within a vaccination zone and being able to complete those zones, so not have delays. And so that's what's showing there on the right is, time to complete a vaccination zone across all these different iterations. So if you look at the beef, the second scenario of vaccinating within 10-kilometer vaccination zone at a high capacity, you're averaging of getting each zone completed within 1 to 2 days with that 85% coverage. And so you're able to not only complete zones quickly, but you're able to handle all the different zones that you might have during an outbreak. So for this scenario, you're looking at, on average, just under 50 infected premises, and so it would be at least 50 or less infected vaccination zones that you'd be working in at different time points, obviously, but you're able to quickly apply vaccine and clear that zone, meaning get all the premises you need vaccinated, as well as handle multiple zones at the same time. If you look at dairy in comparison, a moderate capacity does not have any improvement versus not vaccinating. And so one of the reasons for that is that with a moderate capacity in a very dairy-dense area that has a large number of animals on a premises or per premises, you're not getting vaccine out quick enough within a control area to build up that herd immunity, and you're kind of falling behind on being able to apply vaccine across multiple control areas. So you're seeing that as far as looking at the average days to complete a vaccination zone. So when it takes about 30 or more days that you're trying to work within to clear a zone, you're going to continue to have infected premises are going to increase. You're going to have those indirect movements potentially that are coming in and out of different areas. But overall, you're going to just have more infected premises that could occur versus if you're able to increase your capacity to vaccinate and get vaccine in these zones and be able to work within multiple zones. So the big point here is that having a higher vaccination capacity can reduce outbreak impact for containment strategies, even if, regardless of actually the number of doses that are available. So even, again, as in the previous slide, even being able to work within smaller zones, still that capacity to vaccinate is what's going to be most critical and able to have impact on the spread. There's also going to be a decision point as far as when you look at using protective vaccine strategies, as far as, you're going to focus on a specific species or production type, such as dairy. The importance of this is the same. So being able to target that vaccine and get, needle into animals as quickly as possible is critically important for success of any of these strategies. So knowing what your capacities are and how logistically you're going to distribute vaccine, how many teams you have, your ability, what's your capacity, the ability to ramp up and work in multiple zones if needed, is all going to affect the vaccine plans that are being developed. And I guess overall, kind of trying to aim for being able to clear a zone within 2 days. 1 to 2 days is ideal, but we can still see benefits if it does take, up to 7, 8, 10 days on average to get those zones cleared. And the reasons for that is, again, you have that herd immunity being built up, but spread within a herd, that within herd spread, isn't going to be immediate as far as you have a new case being introduced onto a farm, and then the next day, all cattle on a dairy are infected, for instance. So that does kind of give you a little bit of time for being able to apply vaccine. But, if you get upwards of, if it's taking on average, 10, 14, 15 plus days for you to be able to apply vaccine, you start losing the benefit of vaccine as far as being able to reduce the impact of an outbreak. So key point number 3, so looking at prospective vaccination plans, this is the idea of if you're thinking about, once you get vaccine becomes available to your state or tribe, where best to apply that vaccine. So the first scenario to look at when comparing to the no vaccination strategy, so the second scenario down from that where it says prospective 10-kilometer vaccination zone, that has a 7-day start. So that means that, once you have vaccine available, you're only going to vaccinate in new zones starting at day 7 and going forward. So any zone that was formed before that, within those first 7 days, you're choosing not to vaccinate within those. That compared to if you vaccinate, either receive vaccine or you have a delay in getting teams out to vaccinate premises, of having a 15-day start. So either receive vaccine at day 15, or because of logistics or other considerations, you're not going to start your campaign until day 15 after detection, but you're not going to go back and vaccinate around any infected premises before those 15 days. And so basically, the more delayed application of vaccine you have, you reduce the benefits of vaccination. So that makes sense, right? Because you're getting more towards being a similar strategy of not using vaccine at all. And so there's, is benefit of vaccinating control areas formed about 7 days before vaccine is available. But the longer you delay applying that vaccine, you start losing that benefit. So, as you form these strategies, again, trying to think of, do you vaccinate, all vaccine zones before vaccine is available, or should you save your vaccine and just start going forward? We're seeing that there's a benefits of using containment strategies and emergency vaccination strategies where you do go back at least 7 days to still see benefits of applying that vaccine. So looking at larger vaccination zones, this is kind of, again, tied to capacities to vaccinate. So protective or large, I'm going to say non-targeted vaccination zones. So non-targeted meaning you're not looking at risk of a potential spread, to different industries. You're not looking at spatial spread. You're just kind of throwing a really big ring around an area to choose to do your vaccination strategies. So sometimes these can be counter-beneficial if not targeted based on risk or the number of animals and farms, can prevent the use of vaccine in new areas. So what I'm meaning there is that, if you kind of put all your eggs in one basket, right, you're going to have no more eggs or no more doses available to apply to any new baskets or new infected premises that jump outside of areas of where you're currently applying vaccine. I believe the current strategy that is going to be applied or that's being recommended as far as with vaccination is that once you start applying vaccine in the control area, you're going to complete it. So, at least get it to that 85% level to be able to vaccinate and to be able to not, essentially have wasted doses of vaccine, so you'd want to complete. So by targeted, if you base it on risk, and this is where tracing really comes into play, you're trying, but for the industries you're trying to protect, doing a large vaccination campaign that protects an industry as well as, addresses the risk of where there's current disease spread, you get more value or benefit from the vaccine. And so again, putting all doses into one big area can leave you without doses if the disease jumps out of that area, leaves you without doses that can be applied to help with controlling disease spread into new areas that are outside your current vaccine zone. So I'm going to show an example of this, of what I mean. Hopefully this plays okay. But basically this is looking at a start within a swine industry, a swine dense area, and applying vaccine within a 80-kilometer area, so covering, most of the state essentially within an area. And so you can see that you're applying vaccine for swine, which is that orange color, within one large area, as well as applying vaccine for cattle as well in that same area. And so all your doses are being applied to this area, and you don't have any doses available to apply to new detected areas that jump out of that 80-kilometer area. So you can see some of those green dots are essentially new detected premises that are jumping outside this vaccination zone. And so they're just sitting there. So you're going to be relying on your movement restrictions and your biosecurity practices to try to prevent disease spread in these areas. But especially initially, when you have first detection of a premises, and then you apply a large, blanketed strategy within a zone without knowing if there's disease in other places or in other states that have not yet been detected, is where you can see that, applying a vaccine or, using vaccine all in one zone can really affect or impact being able to use or having vaccine doses available with, to be able to use in different areas. So, again, this is sort of just, highlighting the importance of being strategic, given that FMD vaccine is a limited resource right now, and knowing, where best to apply it, as well as, the importance that, using containment type of vaccination strategies in addition to protected zones can be really beneficial, especially during that first 14 weeks of an outbreak. So you see by day 124, 125 is when we're getting to where we now have vaccine doses available to be able to apply, and now you're kind of doing that retroactive application, delayed application of vaccine. So again, this is just to kind of highlight that point. And so why is that? So just to kind of wrap up and kind of compare, again, what happens when we do different zone sizes. So this is, looking at within a swine dense area of applying vaccine within a 10-kilometer ring versus what that video was showing, a vaccination within a 10 to 80-kilometer ring, and how you can have animals that are waiting to get vaccinated because you don't have either the resources to apply vaccine, or we don't have the doses available. That's the dotted line that corresponds to the left axis on this chart. That's the number of animals that are awaiting vaccine versus the dark black line is how many, that's kind of what the capacity is that you're operating at. So how many you're able to vaccinate per day. And so you can see in this case, if you look to the right, you have a lot of animals that keep queuing up that are awaiting vaccine, and your capacity just cannot keep up, whether it's because of a big zone, but we also see this too when you don't have the capacity within the state to be able to clear zones quick enough and to be able to have the resources and capacity to work multiple zones at once. And so we kind of have this, continued uptick in the number of infected premises that you're seeing there with the red line, which corresponds to the right axis on this graph. So example, we see it, in swine, another example in dairy. So something very similar that, doing a large ring can really affect, especially those first 14 weeks, how many doses you have available if disease were to spread outside those areas that you're trying to vaccine. So kind of, summary of the key points here and kind of what we're seeing, and hopefully we'll be able to dig into a lot of these in future webinars. But, what's critically important and what we're seeing with the modeling is, understanding for states and tribes, knowing, what is your daily vaccination capacity by species and production type, and how many vaccination teams would you have? I believe this is one of the questions that's on that form when we're requesting vaccine, and that's, one of the reasons why it's on there is that we know that this can be a very critical decision point as far as knowing, if you're able to quickly apply vaccine and clear these control zones is going to affect how successful a vaccination plan is. Second point, how does vaccination priorities change when using containment and or protective vaccination zones? So especially early on in the outbreak, we see the impact and the benefit that can happen when you have containment zones being used, as well as that can be used in combination with protective vaccination zones. So, how do your priorities change based on what strategy is you choose to use, and how might those change based on where an outbreak might start? And I'll talk a little bit about that here next, the presentation. And then finally, knowing what species, production types, and or animal types should be targeted for vaccination for each state. So I'll refer you back to Dr. Darrell Stiles' presentation on that, and he gave a lot of really great points of things to consider for applying vaccine, especially during those first 14 weeks, and looking at the kind of biology and host response that kind of can help dictate the prioritization of vaccination. But this is a key thing to think through as well, and to decide, what is it that you're going to try to protect and how that logistically how that's going to be performed. And so one way to do that is actually, not even having to use modeling to be able to do that. So going back to this map Again, this is, heavily based or use the NAS data, so it's public, freely available, and then, I'm sure we'd be able to share with you some of our population files to the states or help with some of these analyses. But, just even within your state, I think you could know, or you can look at, within each county, at least, using NAS data to get an estimate of the density of both animals and premises types within your state, or pull that data from your industry or from your state databases. But, looking at, at each county and knowing how many premises and how many, number of animals on those premises you have, and just, play with, throwing a ring around each of those to see, what would that look like if an outbreak started in the northern part of Texas, for instance, versus the east, west, or southern, and what, those might look like as far as, what's that average number of animals within a ring. And then based on your priorities, what are you looking at if you do that 85% coverage, or at least 85% coverage or more, how many animals is that within a ring? And do you have the capacity, or what are those capacities that would be required to be able to clear those zones and do that quickly as possible, given that's one of the key things that we see as affecting the success of a vaccination plan. So with that, I will end, and hopefully we still have time for questions.
We sure do.
All right, and just as a quick reminder, you can send your questions to all panelists in the chat, or press pound 2 on your telephone keypad to place yourself into the question queue.
We'll give everybody a couple minutes to try and add some questions to the chat or to go onto the verbal queue. I just want to remind everybody, too, that we have a lot of videos, webinars that have been posted to our training and exercise program website, and that link is on the bottom of the original announcement that went out about the webinar. So you might want to check some of those out. The other thing I want to make sure that everybody knows, too, is that we do have a couple more webinars coming up in April that are already scheduled. I'm always looking for ideas for webinars. On April 14th, the public interface approaches during a foreign animal disease outbreak will be presented. And on April 22nd, the basic principles of composting and the USDA protocols for in-house composting of turkeys during avian influenza outbreak will also be presented. And those announcements will be going out in the next couple of days. Do we have any questions in the verbal queue?
There are currently no questions over the line.
Okay. We did get a couple comments. You said a really great presentation. Thanks very much for all of this. And we do have another question. In this vaccination scenarios, who is doing the vaccination? Owner, producer, farm labor, accredited veterinarian? Has workforce availability and biosecurity been considered in the various scenarios?
Yeah, so that's a great question. So in these scenarios, the capacities are just modeling the time it takes to get needle into animal. And so when we compare, low versus moderate versus high capacities to vaccinate, so that would tie back to, how states plan to be able to distribute vaccines over time. So, if you are able to use industry, for instance, or you have more resources or more teams available, beyond what the state has or what USDA has to apply vaccine, that essentially is going to increase your capacity, right? So your ability to, apply vaccine, quicker within a control area and have more teams available to be able to work multiple. I keep saying control area, I mean vaccination zone, to be able to work multiple vaccination zones within, the same time period. So any of those abilities to increase your workforce is going to, in the model, be represented by increasing your vaccination capacities. And so that's how we account for that within the model.
Okay, we have another question. What kinds of products can modelers put together that would help the state's planning for vaccine?
So I think we could do a lot, and that'd be great, great input to receive as far as, what type of product is most useful or most helpful for a state that we could provide. So we've done work previously, for instance, for California, where we did a Tableau dashboard, essentially a visualization software that we're able to share. So it is a software, but there's a free availability of that software that's called Tableau Reader that you can download. And USDA also has the capability of hosting essentially Tableau dashboards is what they are, and use an EOS process, so we can restrict to, for instance, only a state having access to that data. But otherwise, whether it's some of the things that I just showed as far as how scenarios are being compared, or looking at, the capacities within your state. So what I mentioned before with, looking at, the density of animals and premises within the state, and kind of knowing, on average, how many animals would you be requiring to vaccinate if it's within a 3K or 5K or 10K, or if you're looking at, across multiple counties. But some of the analyses that, we could help with or provide, with data that you have available, or we could, do it as a, with the NAS data that we use for our modeling. So, that type of products we can do, or that type of analyses, or I think what's most helpful too is, working with states, or, states working with epidemiologists or modelers within their state or within academia that they know, but just going through the process of what's required, for instance, to parameterize our model requires us knowing, how many teams are you going to have? So we know, how many vaccination zones that you can work at a time. How are you going to apply vaccine? How many doses would you be able to use, and does that vary over time? Use meaning, how many are you going to be able to apply each day? Where are you going to apply it? So all those different type of what if type of, questions are things that, we can apply and use within our model, and then provide those results. And then basically, we always tailor our output based on the question being asked, and make sure that, it allows the ability to be able to compare, and for that to be able to be, one thing that can be used to inform your decisions or inform your planning process for vaccination.
Another question we have is, do you have definitions for the high capacity versus moderate capacity for vaccination, and can this info be shared with states?
So what we did is basically we just kind of set that to as being parameters for us to be able to compare. So I'm not sure if we have like an official definition of what those capacities are, but basically we've been looking at, low capacity of being like, under, about around like 10 to 12,000 animals a day that you can vaccinate, which in some areas, right, could just be one farm that you're vaccinating on. And then we compared that lower threshold to a moderate, which we were saying, okay, well, maybe that's at about like a 30 to 50,000 animals per day. I'll note that I think the UK, United Kingdom, thinks their capacity is about at 60,000 animals a day. And then a high capacity, we're just saying almost, you're not really restricted to doses available. It's, it's more restricted to, at maximum being able to just cover all the zones and the animals within those zones that you would need to vaccinate. So we kind of just vary that so that we can see what the differences are based on either that dose availability or how many teams you have to be able to apply vaccines within your different vaccination zones. And so, we can share, how we're modeling that, but it's not based on any set definition that we have that determines what we would consider low capacity. It's really tied to, what states are able to do. And I think that's where, having that input and figuring out that type of analysis and that type of capability within your state is just so critical. And I believe there's plans for looking at that more closely for exercises in the future, is going through the logistics of, once vaccine is available in the U.S., what all is required to get needle into animal, and then for states, how many needles in an animal are you able to do? So yeah, we can share anything that's helpful, but those capacities we just kind of self put into our model so we can really see what those differences are of how quickly or what's the capacity you have to vaccinate.
We have a lot more questions. Here's a question and a comment. I love the kinds of questions you're asking the model. What other kinds of questions are you planning to model around our response activities related to the activities in the first part of your talk?
First part of the talk. Well, so I guess just to highlight some of the work that we have planned. So we're going to be diving into feedlots specifically. How is it that, if you have a FMD outbreak that either is involved with feedlot, so is on a premises, or a feedlot gets involved because it's within a zone, what options does a producer have so that, just having FMD doesn't drive them out of business, due to depopulation. So we'll be looking at alternative strategies to depopulation, such as, just having a controlled outbreak within a feedlot. How does the configuration of a feedlot, so a lot of feedlots have, different configurations as far as how their pens are set up, where their hospital pen is set up, kind of where animals come on and off a feedlot. Those are all things that we'll be looking at with modeling for the kind of national level stuff that we'll be doing. As we have a lot of focus on, especially those first 14 weeks, but looking at and comparing, all kinds of different scenarios of optimal strategies of both applying vaccine based on where an outbreak starts, as well as, having that limited resource where you could have multiple states, wanting the same resource. How do you decide, what's those optimal strategies and those decision points and looking at priorities of how best to distribute that limited vaccine that can address both industries that we're trying to protect, as well as it being used in a way that can help us, have smaller outbreaks, again, shift that curve to the left. So we'll be looking at a lot of those types of strategies with the model as well.
The next question is, what is the average time for effective titer in the vaccinated animal?
So yeah, and that's a good point. So I think Darrell had a lot of that in his presentation as well, but we are able to essentially model that immunity function on a farm, meaning, with foot and mouth disease vaccine, for instance, we know that kind of, after you, put needle in the animal, so after they receive that vaccine, those first 3 or 4 days, they're still not protected, and then it kind of ramps up over the next, up until day 10. And when you can start having that immunity form, but we also know that the vaccine is not fully protective. So in these modelings that I presented, we look at just only having upwards of only just 25% of the herd being protected. So we can look at, how does that impact any of the strategies, especially in cases where you're doing a containment type of strategy, and you could have that potential risk of being infected while vaccinated and the impacts of that as well. So we are able to model that. We don't look at specific titers. I think that's tied more to some of the capabilities, especially of our diagnostics and the DIVA test that would be expected to be used as far as, knowing kind of what titer is reached for a vaccinated animal.
So we have a question in the verbal queue. So let's go ahead, Will, and open that phone line.
All right, your line's been unmuted. Please go ahead.
Hello, is that me?
Yeah.
Can you hear me? Yes, this is Ed Arza. I actually submitted my question also in writing on chat.
Okay. I do see it, Ed. This is Liz. Do you want me to read your question for you?
I can read it.
Have we considered the successful experience with – go ahead.
Go ahead. No, go ahead, Liz.
Have we considered the successful experience with use of vaccination strategies in South America for control and eradication of FMD in the development of the models and scenarios in this model?
Yeah, absolutely. So as you know, we haven't had FMD in this country since 1929, as well as, kind of the more application of FMD vaccine, especially during emergencies, is something, more fairly recent as far as, kind of last 10, 15 years. And so, yeah, we rely heavily and look heavily at outbreaks in different countries, especially ones that do apply vaccination successfully. So Uruguay being one, South Korea, for instance, where they're able to successfully use emergency vaccination strategies, during an outbreak, and kind of what the strategies they used there and kind of what worked best, and then how that impacted the outbreak. So those, as well as looking at outbreaks elsewhere in different countries, and just seeing how did the disease spread, what was the risk of spread. South Korea, for instance, there was a lot of spread that they noted when your depopulation gets backed up and you have farms that are depopulated, but the time between depop to disposal and disinfection is delayed, and the impacts of that being a risk for disease spread, and one of the reasons why that's accounted for in our model. So that we heavily rely on, just because we haven't had FMD in the U.S., and so what we're trying to do is predict something that can be very difficult to predict, basically, especially based on the data you have available to evaluate. But we rely heavily on other countries' experience form both our strategies that we look at as well as the parameters for our model.
Here's another question. If there is a significant delay in the distribution of vaccine, what does the targeting strategy look like? Is the focus shifted entirely toward new detections versus established hot zones?
Yeah, that's a great modeling question. That's something we can look at. That's one of our planned analyses, is sort of looking at longer delays in vaccine being available or strategy being implemented. So instances where, for instance, what if you use all the doses you have available within the bank within, a handful of states, and all of a sudden you have disease that, gets detected, thousands of miles away, or, 5 or 6 states away into a new area, and you're kind of left without having vaccine available until we start having continuous production. What does that look like? Or, holding off on vaccine and applying it later. So those are all great modeling questions and things that we just started looking at is, what strategies, or how should strategies change based on different types of prospective vaccination, meaning those delays of having an outbreak occur and having those delays for whatever reason before you actually start applying FMD vaccine, to different areas, and how those strategies change based on where the outbreak occurs, how many detections you have once you start using vaccine, and does any of that, change your decision points, or, change your plans of how you would apply vaccine versus if you had it, more closer to when you had your first cases being detected. So yeah, no, those are great modeling questions, and I'll say we haven't looked at that in depth yet, but that's in the queue of a lot of things that we're going to be looking at with FMD vaccines.
Okay, we'll take a couple more written questions. What is the economic relationship between increased surveillance to identify an introduction event versus retroactive control strategies such as culling, quarantine, or vaccination? Optimally, what is the most efficient use of resources?
It's another great modeling question as well. And, we hope to be able to really dig more into the economics. That's very much part of our team is, a lot of the impact of an outbreak like FMD, to include the infected animals, is also the economic impact. So that we haven't looked at heavily, but again, on our list of things to do to start really, looking at with the modeling that we're doing of, what's the benefit of increased surveillance, and, what does that buy you in terms of, when you then decide or not decide to use vaccine versus, some of these delays and when you implement different control strategies. So for sure, one of the things that's on top of our list to look at as well. And hopefully a lot of questions, what you're suggesting as well as what we have planned will be hopefully stuff that we can go in and present more of these types of webinars, or work with states to kind of dig more into those types of questions.
The next question is, in your diamond density map, why did you decide to use the number of farms rather than the number of animals in a specific county or area?
Yeah, this map. So that could be another way of looking at it as well. This was just kind of looking at how many farms, for this instance or for this presentation of how many farms that you would be potentially be involved within a vaccination campaign. Meaning, so if you have your vaccination zone, so, based on the herd immunity that develops and how well the vaccine works, we've looked at, what % coverage that you need for vaccine to actually have an effect of being able to prevent disease spread. And so when you get below that 85%, we start losing the benefits of using the vaccine within a containment type strategy. And then, when you get over that 85% mark, you're not seeing much more increased benefit versus at least getting to that 85%. Anyways, but for this presentation, it was more about, how many farms potentially would be in an area that you would have to vaccinate if you have to vaccinate 85% of them, regardless of the number of animals that are on those farms. But yeah, another way to present the same math is to look at it by animal density versus number of farms. So that'd be something for us to do and see how this map changes based on that.
Okay, I think this is probably our last question. Have you run serotype-specific scenarios? And if so, do you see a significant difference between them?
Yeah, that's a great question, too, and something we have planned and allows me to bring up some of the collaborations we have. So I should have said this at the beginning, but we've been doing the type O, serotype O is what we've shown here, and a lot of our models are based on that. But we have a great collaboration with USDA's Agricultural Research Service, so the folks at Plum Island that are doing a lot of the disease spread type studies to look at different disease states based on serotypes. And there's a couple of publications, great publications that have come out of that work to look at the differences, within the different serotypes, what are the differences in disease states, but even, strains within serotypes, what they see is a lot of variability, even within serotype O, for instance, as far as what those different disease states are. And so that work, some of it has just finished and been published. Some of it should be hopefully published soon. But those are some of the things that we have accounted for in our model and some of with our recent parameter updates last year. But things that we'll be doing in this year is, a lot of work kind of focuses on O, but, how does that change based on different serotype, or more importantly, how does that change based on the variability of disease states regardless of serotype?
And we do have one more question. Are there indications of certain vectors, be it avian or mammalian, in countries that have been affected?
So assume as far as impacting as more of like a mechanical vector of disease spread. So we do know that, when I talk about local area spreads, that's one thing that we account for in the model to account for those types of spread mechanisms that you can't ever identify or really know. Was it rodents, for instance, that was affecting disease spread over a local area, or could wildlife, have an impact, or is it possible for the virus to be carried, mechanically on flies or something like that and spread to a neighboring farm. So those things we try to account for within that local spread parameter, but we very much have that in there because of, a lot of, especially in the United Kingdom's 2001 outbreak, a lot of the studies and some of the case control studies and a lot of the kind of reports that came out of that outbreak where they had a lot of, spatially unexplained spread that they couldn't identify through other indirect or direct movements of animals, that they believe that, rodents or wildlife or other mechanisms came into play to mechanically spread the disease, because it's a virus that can be spread so easily. So that's one thing we do account for in our models, and as with the previous question, kind of look at other countries' evaluations and their epidemiological reports that come out of outbreaks to see, what kind of factors came into play for disease spread, so we can account for that in our model.
Okay, I think this is going to be the last question we can take because we're going to start to run out of time. What vaccine efficacy do models assume? Is efficacy defined as preventing clinical signs?
That's a great question, too. So based on what we know and some of the things that Dr. Daryl Stiles has presented is we assume that 70% of animals are going to be protected, you know, once you implement vaccine on a farm. And so we represent that within the model. So we know that our model does not say that, you know, a vaccinated farm can never shed or never be infected, for instance. So we do model that. We still, you know, show in our model or have where even vaccinated farms can still become infected. And then we have parameters that look at the infectivity of a infected but vaccinated farm, you know, what's that infectivity to other farms. So we do know that, you know, vaccine, you know, if they do become infected, that vaccine will prevent shedding. And so we account for that within our model. And we don't, you know, we don't completely cut off shedding and say once they're vaccinated, they're fully, you know, protected. We just decrease the shedding compared to a non-vaccinated and infected farm. And then the other part of your question, the clinical signs. So that's also parameters in our model as well. So that passive surveillance that I mentioned before. So once, you know, there's a detected outbreak and you kind of have an increased awareness of FMD being in the country, you know, we can change and have it more likely that producers would report, hopefully, or be looking at their animals to be able to detect FMD. And that is very much heavily tied to the differences in clinical signs that we see with foot and mouth disease by species. And so we then, you know, tailor that parameter even more to say if it's now an infected, vaccinated premises where the vaccine is essentially eliminating the clinical signs even though they're infected, then, you know, it's less likely in our parameters reduced that the passive surveillance would occur based on clinical signs because it's likely you wouldn't observe clinical signs. But then we can also, you know, have parameters that are specific for the DVA vaccine diagnostic capability of being able to detect infected versus vaccinated animals.
Okay. With that, we are at 2:15 on our time frame, and I think we'll close down with our questions. Are there any questions in the verbal queue?
No questions at this time.
Okay. So on behalf of the National Training and Exercise Program, I would like to thank Dr. Holmstrom for presenting today. It was a great, great presentation. And also thanks to everyone who attended the webinar. The NTEP will be offering several other webinars to support the FMD vaccine exercise series over the next few months. And also, if you have any ideas for webinars that the Vet Services NTEP can explore for our emergency preparedness community, please feel free to contact us. I'm always looking for another webinar idea. You can find other webinars on vaccine and many other topics on the TEP video gallery online, which is posted on your announcement. And with that, I will bid you all a great afternoon, and thanks again, and take care. Please be well and safe during this time.
That concludes our conference. Thank you for using AT&T Event Conferencing Enhanced. You may now disconnect.